I'm Justin Smith, the Product Marketing Manager for Intelerad Medical Systems. Today I have the pleasure of meeting with Dr. Sean Skay from Canterbury District Health Board, Christchurch, New Zealand. Thank you for being here today.
Thank you very much for inviting me. The role of Chief is really, I guess, making sure that from a clinical perspective, radiology provides what it should provide in every sense of the word. And it's about improving and working towards improved patient outcomes and very much patient-centric care, especially out of our radiology department. We've done a lot of work around that, and it's particularly around the informatics that's sort of facilitated a lot of the improvements we've achieved in terms of faster turnaround times, getting the reports out as quickly as possible, timely imaging, timely reporting of those images so that the patient can continue on their journey.
Making it easy to share images, working with other organizations, we talked about work lists. Has Intelepax or Intelerad helped you in that regard with things that might be going on in your region with different organizations, things of that nature?
Absolutely. What we have in Christchurch, in recent years with the earthquake, we've had a bit of an outflux or outflow of radiologists, which has created problems for us in the public system in terms of trying to keep up our, managing the demand with a reduced reporting capacity. This is one of the things that we have discovered over the years is the radiologist reporting capacity is one of the biggest constraints in an organisation in terms of producing timely and relevant imaging. So the private practice in Christchurch, which is part of a bigger group, also have Intelerad and the same risk vendor, and this has been amazingly helpful because having the same systems, we can look across each other's into each other's PACSs. Now, this is from a patient's perspective awesome because patients often starts a journey by seeing a general practitioner who then might refer them on to a private specialist, and then they come back into the public system, and the imaging actually follows them in a sense that we can go and look up the imaging in our private practices PAC system. So we have access to that. Just going back to the time of the earthquake and subsequent to that, we've managed to, utilising that link, share our workload with the private sector. And we're struggling to report all of our images and get timely reporting out by being able to push out some of the work across workload balancing, or load sharing is really what it is. We could get the private sector to actually pick up some of our demand and report it for us.
What would you say, I'm sure you've touched on it before, is the key feature, one main thing that stands out that Intelerad's solutions or service or specific features help you deliver better patient care right now?
I think without doubt, having a PAC system that is robust, does not fall over, is available 24/7 literally. And one of the things I'm told is that our system's monitored from afar, and they often know there's a problem before we even realise it, and often sorted the problem before we even knew there was a problem. It's that reliability. It's the easiness or easy use of the technology. We've brought in some new radiologists, and I would say that within a day or two, they're already starting to become productive, which to me says something about a product. If you can sit down in front of it and it takes you a day or two to get your head around it, it's a good product. It's easy to use. That's important. But it delivers what it needs to deliver in terms of functionality and assisting a radiologist in what they do, and that's reporting cases,